Bienvenue sur Health Talk pour la dernière émission de la semaine. Ici, votre cher serviteur, votre infatigable serviteur, comme tous les mardis, comme tous les samedis. Je vous souhaite la bienvenue dans cette enceinte familiale pour une autre émission aussi intéressante que la dernière. Donc, je vous demande à tout le monde de se réunir devant le petit écran pour converser, pour chatter et puis apprendre quelques notions sur la santé. Donc, tous réunis ce soir pour l'émission de prédilection, l'émission que la communauté apprécie beaucoup, l'émission d'où la communauté trouve l'éducation bien méritée. Encore une fois de plus, je dis bonsoir à tout le monde et soyez la bienvenue. Mille merci d'être branchés. Et le mot d'ordre, comme tous les samedis, comme tous les mardis, je vous demande aussi tout branché de partager l'émission avec tout le monde. Monsieur François, bonsoir. Soyez la bienvenue. Tu es la première à être branchée. Mille merci. Ta fidélité... ta fidélité est vraiment énorme. Donc, mille merci pour ta fidélité. Tu es toujours présente. Soyez la bienvenue. Et comme d'habitude, comme tu le sais, je te demande de partager l'émission avec tout le monde. Bonsoir à tout le monde. Entre-temps, ce que je vais faire, je vais commencer à inviter quelques amis pour prendre part, mais néanmoins, ne laissez pas rester ici. On va discuter sur une série de topics assez intéressants. Et vous allez voir que ces topics vont vous servir beaucoup, bel et bien. Bon, good evening, this is Dr. Benoit for Health Talk. Great afternoon, great evening to everybody. This is the second show for the week. I'm inviting everybody to be part of this program. Welcome to Dr. B with you. We're going to talk about two important topics. And those topics probably will serve you somehow for you to think about. Okay? So I'm inviting everybody to join me and share the live. Bonsoir tout le monde, c'est Dr Benoit qui est là avec nous. Une fois de plus, c'est avec un grand plaisir que je suis là avec nous, pour nous partager les choses là, pour nous apprendre ensemble. Et à ce soir, il y a deuxième show pour semaine-là. Mais j'espère que tu passes une très bonne semaine. Et puis nous allons essayer d'aborder un topic qui est assez intéressant là. Mais j'espère que dans tout cas, participer. Mais comme nous connaissons que la façon pour nous participer, pour nous aider l'autre à participer, c'est partager le choix avec tout le monde nous connaît, toute race, nous, toute famille, nous, toutes amis, nous. De ce fait que, chose qui arrive dans les oreilles en pile l'autre monde. Ok? Donc, là, c'est Dr Benoit qui parle avec nous là. Nous invitez nous pour nous participer avec moi dans la chose ça et puis nous même tout pour nous partager les avec tout le monde que nous connaissons. Ok. Entre-temps, ça m'a fait là, m'a invité quelqu'un là pour venir pour partager pour venir regarder show avec nous, mais en même tout, ça m'a conseillé au fait tout, c'est fait tant mieux d'inviter des gens pour faire part de cette émission. Donc, merci beaucoup pour tout le monde qui est branché. Et c'est nous-mêmes qui vous fait choix. C'est nous-mêmes qui vous partagez le choix avec tout le monde qui nous connaît. Encore une fois de plus, c'est Dr Benoit Cavola en direct, bel et bien, qui peut pas parler de série de topics là qui est très important. À ce soir, ça nous a déjà pour nous. Ce soir, nous avons deux topics à soir. comme d'habitude. Premier topic là, c'est un topic sur médecine. Gagné et une révolution qui fait dans la façon que vous traitez les gens qui ont une maladie diabète. Il y a une série de nouveaux médicaments qui viennent là. Et nous allons parler qui fonctionne médicament ça, groupe médicament ça, et puis qui ça est fait. Aussi bien nous allons regarder que et qui monde qui prend médicament ça, qui ça médicament ça fait, qui révolution les fait qu'on y a gens traiter monde qui fait sucre. OK? So vraiment nous si que vous c'est un docteur et que regardez là et au cas apprendre nos bagages parce que bah ça c'est nouveau donné au cas apprendre à partir de ça on va dire là tout et pour tout au cas soit pas condamné au cas apprendre. OK? Si son médecin étudiant en médecine tant mieux, on va plus apprendre toujours. OK? Si son médecin en nursing, on va apprendre en pile toujours. OK? Et deuxième topic que nous allons parler, qui en fait que les deux mondes divorcés, surtout non pas garçon, et garçon divorcé avec ex li, immédiatement les divorcé avec petite li. OK? Ça pour ces garçons divorcés avec tout le monde, ni femme, ni petite. Nous allons regarder phénomène ça. OK? So, moi, tout le monde là, parlez-nous, branchez-nous. Je ne vais pas commencer tout à l'heure là. Entre-temps, je vais essayer d'inviter au plus vite, plus de monde que possible. Non, show là, pour tout le monde qui a regardé show là, pour tout le monde qui a participé. Donc, tonight we have two topics tonight. The first topic, there has been a revolution in the treatment of diabetes. We're going to look at the new therapeutic modality in the 21st century, the approach for diabetic treatment regarding those new therapies. And the second topic would be why when two people are being divorced, they especially on the side of the man will divorce both the ex and also their children. Okay, what propels many men to do that? Okay, that's the topic for tonight. That's what we're gonna look at. So I'm asking everybody, brace themselves. We're gonna have a heck of a show, and you're gonna enjoy what we're gonna talk about tonight. Ok, bon gade là, m'a fini vite quelques moun là, et puis après ça, nous pour aller et commencer le show là, d'emblée là, m'a fini vite quelques moun là, après ça pour nous commencer le show là. Ok, alright. Bon, salut quelques moun là. Michel Cadet, tu étais la première à être branchée. Mille merci, bonsoir, share the live. Sarah Desgraffes, bonsoir, share the live. D. Victoria Hill, bonsoir, share the live. Sabine French, bonsoir, and share the live. Tamara Rainbow, Zami Pam, salut, share the live. Sabine French, thank you for the compliment about my shirt. Thank you. Thank you. Marjorie Petit, bonsoir, share the live. Mildred Tassi Simon, bonsoir, and share the live. Joseph, bonsoir, and share the live. Kani Olivier, toujours présent. Kani, toujours présent, fidèle au rendez-vous. Salut, and share the live. Nounoun Soreille, salut, share the live. Marjorie Dubois, salut, and share the live. Tamara Rainbow, Zambi Pam aussi bien, pour tout le temps, share the live, my sister. Nounoun Sorail, salut, share the live. Sabine French, thank you very much for sharing the live. And Nounoun Sorail, bonsoir, and share the live. Let me see si je peux continuer à inviter quelqu'un toujours là. Entre-temps, moi, je plus de monde à regarder, non? Bon, regarder si je peux inviter plus de monde. Regardez si je peux inviter plus de monde toujours là. Dans le show aussi là. Ok, entre-temps, on va dire nous-mêmes pour nous continuer à share live là avec tout le monde. Pour nous gagner une audience qui est beaucoup plus grande. Ok? Ok, comme on dit, nous avons deux topics. Nous avons un topic sur diabète, là, nous allons discuter. Et puis, nous avons un topic sur un topic sociaux. Nous allons discuter. Ok. Ok, so faites brancher là. On suit Dr Benoit. Qui est voilà. Qui parle faire un petit parler avec. Okay? All right. So tonight we have two topics tonight. The first topic we're going to talk about the new therapeutic modality in treating diabetic patients. That's the first topic. The second topic we're going to talk about, how come many people who are divorced or being divorced, they divorce both the ex and also their children. All right? And it's usually the man that behave this way, but we're gonna look at what propels men to do that. Okay? All right, so let me stop right here. Let me start the show now. Let me see, comme t'es Nadine Daisy, salut, share the live, Nadine. Mathon Leslie, salut, share the live. And Gégine Benjamin, salut, share the live. Bon. First topic. There's a new modality of treatment in terms looking at patients who are diabetic. And let me give you a synopsis about diabetes. Diabetes is a systemic disease. It affects all major organs in the body: the brain, the heart, the kidneys, and the vasculature. And diabetes has dire consequences on these organs. Now, in the 90s, there was some kind of a revolution. Also in the 80s, also 80s and 90s, there was a revolution in the treatment of diabetes. Not only in the control of the disease by certain clinical trials, like for those of you, right, who are doctors, you can understand what I'm saying, called the DCCT trial, looking at the control of the sugar. If the sugar is well controlled, it retards the progression of the disease, meaning retards the complication at the level of the heart, at the level of the kidneys. All right. But there's a group of medication which became a darling in the treatment of diabetes, all right? Not solely to retard the progression of disease in some other organs, mainly the kidneys, called ACE inhibitors. In the 1980s, the capital trial was by Lewis. Is a study that was done looking at captopril, which is one of the first ACE inhibitors around, had some benefits in patients who are diabetics. It retarded the progression of diabetic kidney disease. And in the 90s, then you have new classes of medication called angiotensin receptor blockers, called ARBs. Then you have the angiotensin 2 antagonists come along. All of them is to trying to block this cascade, because this cascade is mostly responsible for the etiology of blood pressure, which is called the renin-angiotensin axis. So I'm giving you some kind of historical perspective in terms of the disease in question. Diabetes has been looked at. So most of this medication, remember, a lot of new medication for diabetes, also for the disease itself to treat diabetes, has come into play. A lot of insulin derivatives and non-insulin derivatives has come into play to treat the disease. Now, nevertheless, diabetes has always remained a serious challenge to physicians because the consequences are dire. Now, namely, the complication, stroke, heart attack, and diabetic kidney disease. These are the three major consequences that diabetes face: cardiovascular disease and renal impairment. So again, most doctors, most physicians are always find themselves in a real dilemma in treating patient with diabetes, because they tend to have all those complications. All right, stroke, heart attack, kidney disease, and amputation. So, and most of the prior trials or studies, all they've done, they by controlling the sugar, they retard the progression of the consequences in question. For example, if your sugar is well controlled, you have less incidence to have a stroke. If your sugar is well controlled, you have less incidence to have a heart attack. If your sugar is well controlled, you have a less incidence to end up in dialysis, and so on and so on. And that's why the premise of those all these trials. Okay. So we were always in a way cornered how to stop this devastating complication, which is diabetes. Now, and let me tell you also, diabetes is the #1 cause for patients end up in dialysis, and primarily Black folks. As you can, if you look in the dialysis in the urban area, 90% of the patients on dialysis, they're either diabetics or hypertensive. And you know, once you're diabetic, you're going to become hypertensive. So diabetes comprise a whole bulk of patients on dialysis. So tonight, what I'm going to tell you tonight is something very, very important. And I think that you should take your pen and pencil to take notes. So I gave you a little bit of historical perspective, what we have done as in the medical community to face off with this disease, diabetes. And from 2016, that's all doctors we've done to retard the progression of the disease. That's all we've done. From 2016 onward, there have been a plethora of trials on a new class medication, which is called the sodium glucose cotransporter inhibition 2. This class of medication has brought a breather to physician. So from 2016, there has been a revolution, and in 2019, the trial started from 2016, but it's only recently in 2019 whereby that all the studies are out there, whereby that doctors can read about them and then use them in clinical practice. So the new class of medication, what it does, it's there in the kidney. There are different parts of the kidney. There's a part that is proximal, that is the first part. At the level of the proximal tubules, what those medication does, they reabsorb glucose, right? Hence, once the glucose it's in the proximal tubules, there's an increased activity of this cotransporter, which is the sodium glucose transporter. As it reabsorbs glucose, it drags sodium with it. All right. So a person who has high activity of glucose at the level of the kidney, so that transporter is very active in diabetics. In diabetics, that's what happened. You have a high activity of the transporter at the level of the kidney. So they said to themselves, if they can find an inhibitor, that means that a medication that can block that cotransporter, therefore the kidney would not reabsorb glucose, the kidney will not reabsorb sodium, and hence there will be excreted, and therefore the glucose will be controlled, and then there will be less sodium load in the body, and hence the blood pressure will reduce. Remember also, when the kidney will absorb that glucose, also that glucose is reabsorbed at all cellular level in the body, and primarily when glucose is high, it's very toxic to the body, and what happens, your cardiac muscle reabsorb a lot of glucose as well, and a high glucose at the level of the heart causes a cardiac dysfunction, make your heart enlarge, and hence you end up having a heart failure. So that's why many patients who are diabetics, they have hypertensive because of many other things. Not only they have the renin-angiotensin system, which is responsible for the blood pressure in your body. It's very active, but there is a high activity of sodium and glucose reabsorption at the level of the kidney, making the glucose high and your salt high. So lately, they found those inhibitors that block the uptake of sodium in the kidney. Okay? Those inhibitors that block the uptake of sugar in the kidney. They found those inhibitors. So those inhibitors now, they are the darlings of the treatment of diabetes. Why? So if you just branch on, you're listening to Dr. B giving you something new stuff in medicine. If you're a doctor, you don't know that, you can take it down and then you can go and read it. Marie Saint-Pierre, salut, share the live. Claudine Museau, salut, share the live. Dominique Payan, salut, share the live. Marcel Nicolas, salut, share the live. Iliane Medina, salut, share the live. J. Chéri, salut, share the live. Iliane Medina, thank you very much for the appreciation. Nancy Mayerome, salut, share the live. So, I hope that I'm not too scientific, but I try to explain very simple so you can understand, because not too many people here are doctors. So again, let me say that again. When you are diabetic, you have an increase of activity of a co-transporter at the level of the kidney. Those co-transporter, they increase the uptake of sodium, they increase the uptake of sugar at the level of the kidney. So remember, so if the kidney uptakes the sodium and the sugar, so eventually your glucose is going to be high. Your blood pressure, if your sodium is up, bonsoir évitez au date, bonsoir, your pressure will be high. So those things will be high. So if you can find a medication that blocks the uptake of those two substances, you can achieve a lot of wonder. So that's why that those medications come into play. They're called sodium glucose co-transporter inhibitors. Okay. Now, there has been a lot of studies. There are at least 3 major sodium glucose co-transporter inhibitors. There has been a lot of studies on those medications. But one of the study that is really has put them into map is called the CREDENCE trial. The CREDENCE trial has shown that if you take those medications, those inhibitors that blocks the uptake of sugar in the kidney, they decrease the progression of diabetic kidney disease. They decrease the incidence of proteinuria in the kidney. They decrease the incidence of somebody going on dialysis. They reduce the ability for somebody to go and for transplant. Just at the level of the kidney. Just the kidney. So far. Just the kidney. So those medications, those inhibitors, they prevent, if they give them to a patient, they blocks the activity of that co-transporter at the level of the proximal tubules, and then the person is unable to uptake too much sugar and sodium. So based on, there are many trials. For example, there's what you call the CANVAS trial. There is a trial called EMPA regular outcome trial. There's so many trials being done on those inhibitors, but one of the trial that has really put those inhibitors into the map is called the the trial that I just mentioned a while ago, that trial as the CLIQUEZ trial. The CLIQUEZ trial is a trial that has shown clearly those medication, they halt the progression of kidney disease, they decrease proteinuria, like passing protein in the kidney, they reduce the incidence of diabetic patient going into dialysis, they produce patient going to transplant. So this is the level of the kidney, but there is most of this medication, you need a certain amount of kidney function that is recommended to be used. So based on this study, your kidney function should be between 30. You start patient on this medication with a kidney function between 30 to 45%. However, in the study that on the CLIQUEZ trial, they allow patients to take their medication till they have gone into a dialysis. So there are more studies coming up to really broaden the recommendation of this medication. But for now, anybody with the kidney function between 30 to 45, between 30 to 45, up to 60, those patients, they should be on this medication. Now, so this is just the level of the kidney. Now, so in a way, this medication, not only they control your sugar, they're also a diuretic. And there has not been any medication in that category that does that. Now, remember, I told you that those medications prevent the sodium to be uptaken by the kidney. And that has a dire effect on the heart. So many patients who are diabetic, they suffered heart failure. And many of them end up not only have kidney problem, they have heart trouble. So those medication, not only it is renal protective, meaning that it protects your kidney, it is also cardioprotective. So it is the first time since in the 80s we have such a medication that always not only protect the heart, the kidney, but they don't retard the progression of the disease. They stop the progression of the disease. That's a big difference. They completely stop the progression of this disease. This is to show you those medications are gonna be in the 21st century. Like for most diabetics, it will be a lifesaver. A lifesaver. So any patient who has diabetic kidney disease, any patient who has protein in the urine from diabetes, any patient who has a kidney function about 30 ml per minute up to 60, they should be on the medication. Any patient with heart failure from diabetes, should be taking medication, should be taking those medications. Okay, so those medications, they are approved by the FDA to be given for this recommendation for those patients. Now, so if you stop the progression of diabetic kidney disease, you'll prevent a lot of patients to go on dialysis. If you stop the progression of diabetic kidney disease, you'll stop many patients to go into transplant. If you stop the progression of cardiac disease, people going to be more functional, and then they don't have the, because heart failure is the #1 cause for hospitalization in the United States. So for the most part, most patients who have heart failure, most of them are diabetics. And heart failure is never cured. Never cured. And there's a new term now. We said heart failure is stable. Nobody with heart failure is ever stable. As a matter of fact, they said that when you think that the patient is stable, that's the time that the patient has more problem. So, those medication are good medication. Now, but they're mostly for diabetic patients with kidney disease. Now, they are having more studies to see if those medication can be useful in non-diabetic kidney disease. Right now, those medications, they are indicated primarily for patients with diabetic kidney disease and heart failure. Now, so it's a whole revolution. It's a whole revolution in the treatment of diabetes. Now, so when you have a diabetic, usually the patient has a high sugar, you have to treat. The most important, the first line of therapy for any diabetic is metformin. Everybody knows metformin. Metformin also, what they do, they act at the liver and then preventing insulin resistance, which is the hallmark of the treatment of diabetes. And those medication, also the medication I talked to you about, the sodium glucose cotransporter inhibitors, they also act on insulin resistance. Okay, so not only they control the sugar, they control the kidney, and they control the heart. There's no medication that does that. There's no medication for diabetes disease that does that. Only those classes of medication. Okay? Only those classes of medication, they are the only classes of medication that not only control the sugar, and let me say by the way, those benefits, those cardiac benefits are independent of the control of the blood sugar. Independent. Okay? All right? So that means that they act something in other ways to prevent cardiac disease. Now, as I was saying at the beginning, when you have a diabetic, the first line of treatment is metformin. Metformin it remains the first treatment. Now, but things are being changed now. If a patient, whether the patient has never been treated before and the patient has evidence of diabetic kidney disease and heart failure, the first line of medication, the first line of I'm gonna answer you very soon. The first line of treatment for this patient are the sodium glucose cotransporter inhibitors. All right, now things change. Things change. If somebody is diabetic and the person has no problem, metformin is the first line medication. But if a diabetic has evidence of diabetic kidney disease by having proteinuria, by having peripheral vascular disease, that means that the person has pain in his legs, the person has history of a heart attack, the person has history of a stroke, the person has history of heart failure, the first line of treatment of medication is not metformin anymore. The first treatment are the sodium glucose cotransporter inhibitors. And the second line of medication is called the GLP agonist, which is called the glucose-like peptide medication. Okay? And I've seen a lot of you have seen them on television, like Trulicity. Trulicity is a GLP-1. Tenzium is a GLP-1. Baeta is GLP-1. So all those medications, they're called GLP-1 agonists. What they do, when you take them, they stimulate your pancreas to form insulin, so that insulin can bring your sugar down. And also they block, because once you eat, you stimulate glucagon. The glucagon, what it does, it increases your sugar, right? So those, they're called incretins. They stimulate insulin. Insulin will bring your sugar down, and they block the postprandial rise in glucagon, preventing the food that you eat would not increase your glucagon, hence increase your sugar. This is called the GLP-1 agonist. So those two classes of medication, the sodium glucose co-transport inhibitors and the GLP-1, are the recommended medication now for patients who are diabetics and who have evidence of diabetic kidney disease, heart disease, and cardiovascular manifestation. This is new stuff. Là, c'est bagay qui fait sortir bien clair là, différent. So, moun pas qu'à traiter et diabète, je vais traiter diabète longtemps. Hein? Moi, je dis, well, good question. I'm gonna answer you. Avec Rodette, salut, Shadow Live. Claudie Saint-Jean, salut, Shadow Live. Margaret Ford, salut, Shadow Live. Marie-France, salut, Shadow Live. Hermétie Léon, salut, Shadow Live. Amélie Chevalier, salut, Shadow Live. Yannick Durozo, salut, Shadow Live. Iner Delis, salut, Shadow Live. So, quand y a un pas à traiter, sucre, même traiter longtemps. Et ça fait que, faut un docteur toujours sous ballonné, parce que faut li aware of the no treatment. Parce que si que docteur après toi avec même petit médicament yo, ou a bien problème. So, j'ai longtemps, et il était toujours, metformin considéré premier line of therapy. Tout dépend que j'ai un patient présenté. Si patient pas un problème de rein, patient pas un problème évidence de maladie cardiovasculaire, qu'on a un stroke, qu'on a un heart attack, qu'on a un heart failure, metformin is good. Mais si patient, son patient qui paraît, même si patient pas jamais été sous médicament pour ceux, patient gagne évidence maladie rénale à partir de sucre, patient font stroke, patient font heart attack, patient fait patient gagne heart failure, patient gagne evidence of peripheral vascular disease, ou patient gagne gangrène dans pied li, ou bien patient en amputation, the first line of treatment, li pas metformin encore. OK? First line, c'est sodium glucose co-transporter inhibitors and GLP-1 agonists. These are the two first line of medication for somebody with diabetes. Now, yo trouvé que médicament ça non seulement que ça fait yo bon ça, gon série de inflammatory markers ou gen encore ou, c'est eux même qui cause tout problème ça yo trouvé médicament ça yo bloqué surge of these inflammatory markers. Par exemple, tumor necrosis factor sont inflammatory markers. Interleukin 1 sont inflammatory markers. Fibronectin, tout bagay ça aussi yo causé pour rien vini et dead. So, médicament ça yo, me parler tout à l'heure là, nouveau médicament ça, li empêcher marqueur ça yo proliférer et de ce fait que qu'il n'y a arrêté jam. Now, demandez-moi que are there any natural ways of decreasing insulin resistance? Now, insulin resistance is the hallmark of type 2 diabetes. Type 2 diabetes. And look at and that's the most important aspect in treating patients with diabetes, because you have to block that insulin resistance. Like metformin, it acts to prevent insulin resistance. And the new medication, not only it does all those wonders, it blocks insulin resistance also. So I'm not aware of any natural medication that does that. Now, as you can see, medicine is evidence-based medicine, and you cannot play like doctors can gonna play like this, because a natural medication can pretend to play a role in treating diabetes, but there's no study to it. Those medications that I've just told you now, c'est comme ça qu'on y a là, yo traité moun qui fait sucre. Si qu'on a traité sucre, j'entends qu'on est sucre 10 ans de ça, patient pas besoin de bénéfice yo. Bagay yo changé. That's new bet, nos données qui tombé, qui récemment tombé, gens qui ont traité médicaments. So, classe médicaments, ça qui me parle aujourd'hui à là. Et le besoin que mon noir, c'est years later, yo joignent avantage médicaments ça, parce que et en pile dans yo pas gagné bon assurance, et puis médicaments ça parfois ils coûtent cher, you pas afford them sometimes. But nevertheless, qu'on y a là, on va me dire là, nouvelle classe médicaments ça yo apporté un nouveau concept qui gens pour traiter monde qui fait sucre. OK? C'est pas patient insuline seulement, checker A1C qui seulement. No. OK? Gen gens pour garder patient. Faut garder patient as a whole. Faut garder si patient te font stroke, si patient gen heart failure. Et pour patient gen heart failure, patient gen de fois patient pas au cas pas même connaît patient gen heart failure, sous pas fait study pour patient. Et pas changer net, oui. Parce que c'est pas chita à docteur, la docteur a écrit parce que pour non, bah changer. Faut docteur faire more investigative study pour regarder si gon présent heart failure. Parce que il y a des gens qui fait sucre, qui ont évidence de heart failure, ils pas même connaître si heart failure. Yo ouais que yo pas qu'à marcher, yo ouais que yo on tient bouquet, yo dit ah, c'est pas rien ça. Et pourtant c'est cas présent of heart failure. So faut docteur faire more study, faut moins étude et test pour garder que sous gon un heart failure. So tout monde qui fait sucre, yo ouais que ou fait sucre, et puis avec sucre là, on a un problème kidney, et le problème kidney lui-même, pour le docteur Welly, c'est pas seulement test sans non, le docteur fait pour il y a un test qui antigen beaucoup plus aller au-delà, qui garde que si vous gagnez protéines dans l'urine, parce que chiffre cas normal dans rien, et puis aussi il y a un problème kidney, parce que il y a un monde qui a problème par exemple, gagner 40% de monde qui a problème kidney qui pas gagner protéines dans urine. Regardez, 40% de monde qui fait sucre, 40% of diabetic patients, they have diabetic kidney disease with no protein in their urine. And the only way you can know that unless you are a kidney specialist. The regular doctor will not know because that's not his expertise. That's why many times a diabetic patient should have should have a nephrologist along the side of the PCP to treat the patient. So 40% of patients with diabetics, they have diabetic kidney disease with no protein. All right. However, the overt manifestation of diabetic kidney disease is manifested by protein in the urine. Once you see the protein in the urine, it's usually sometimes it tells you that the sugar has affected the kidney. For example, also, si patient gagne diabetic retinopathy, si sucre la affecte yeux moun nan, si sucre entre dans yeux moun nan, moun sa yo supposé sous nouveau médicament que m'parle nou la konya la. Parce que l'orgue sang dans yeux ou, c'est que dit que ou gon et trop de sucre là, c'est lui même qui poison. Même trop de sucre qui est dans yeux là, il est dans cœur, il est dans brain. So médicament ça yo decrease the uptake of sugar not only at you decrease it at the level of the kidney, but indirectly they decrease that level at the level of the brain and the heart. Okay? So, nouveau bet, si que ou fait sucre, ou gen présence de maladie rénale, rein, ou gen présence ou stroke, ou gen heart failure, ou te font heart attack, ou gen problème gangrène dans pied ou gen problème peripheral disease, metformin c'est pas nouveau médicament ça pour ou. OK? Nouveau médicament pour c'est une nouveau classe de médicaments qui fait sortir. Yo sodium glucose co-transporter inhibitors et puis avec un autre groupe médicaments qui est le GLP-1 agonist. Ces médicaments ça qui should be the first line of treatment. Okay, now, moi je veux dire que est-ce que ça l'effet? Yes. Gen ça l'effet et m'ga ba non ça l'effet yo, mais m'ba montrer non que étude démontrer que ça l'effet ça yo minimal. Par exemple, yo dit que médicament ça yo ka causer et diabète ketoacidosis, c'est-à-dire que yo ka fait acide dans corps monter en pile, yo ka fait sucre là ka déranger, tout déranger. C'est yon. Yo fait comprendre que médicament ça yo ka causer et acute renal failure, c'est-à-dire que vous avez acute kidney injury, c'est-à-dire qu'on bagage qui paraît tout d'un coup dans kidney l'affecter kidney. Il dit comme ça que il ka causer injection et infection dans partie génitale. Il fait comprendre que que médicament ça yo ka causer cancer of the bladder. Now, mais récemment dans trial qui relait the Credence trial m'a démontré que ça fait que ça yo minimum as you join the most common side effect non pour mon qui prend médicament ça you relève ça de Fournier gangrene. De Fournier gangrene c'est gangrène de partie génitale c'est avec partie derrière. Mais c'est la seule médicament ça qui a causé de Fournier gangrene. Par exemple, metformin qui a causé, Januvia qui a causé, et Trulicity qui a causé. OK? So, yes, médicament ça most of the common side effect is urogenital infection. Par exemple, gangrene of the perineum and also the genital part. But the benefits outweighs the risks. So it's they are minimum. Okay, but however, it's always important to know. It's always important to know the side effect. Pas de médicaments qui va un side effect. Marjorie, I hope I answer the question. Denise, Sarah Amalia, salut. Willine Guerrier, salut. Kierta George, ma collaboratrice, salut. Share live. Ismani Angelville, salut. Raoul Saint-Flavin, hey Raoul. I'm glad you're on, brother, because I just talking about some new treatment for diabetes, and I hope the doctor that where you're at can really start you on this medication. All right. Okay, Raoul. Let's voir. If you are nearing pre-diabetic with an A1C 5.7 and you want to lower your A1C, your option is metformin. I thought maybe diet and exercise, avoiding carbs and starches might help decrease insulin resistance and lower the A1C over time, maybe 5. Well, let me tell you. Now, if you are 5.7, okay, there's no need for you to take metformin. The indication of metformin is when your A1C is about 6.5 or more. Now, a while ago you said that. Let me see. What was the question you asked? The question that you asked: are there any natural ways that I thought it was natural medication ways. So one of what you mentioned, exercise is one. Exercise can decrease insulin resistance a little bit. That's for sure. But if your A1C is 5.7, there's no need for you to take metformin. All you have to do, as you said, is exercise, avoid carbs, and you should be okay, and lose weight. That's all. Lucia Labranche, salut Shadow Live. Josiane Lérisson Fidélia, salut Shadow Live. Aliette Julia, salut Shadow Live. Rose Magali Irtiam, salut Shadow Live. Good evening. Good evening. You're on the Big Apple. Enjoy the Big Apple. Amelia Ingrid Lira, Shadow Live. Monique Desrougen Barbier, salut Shadow Live. Marjorie Dubois-Daru. Yes, exactly. Even water has that effect. Exactly. For example, Marjorie Dubois. When a runner, a marathon runner, is in a marathon, you see people who, along the way, will give them water. Is a bad thing. It's a bad thing. Bad thing. Because a marathon runner should not drink a lot of water when running. Why? Because as the marathon runners, this is to show you the side effect of water. This is to, as a marathon runs, he sweats. He loses a lot of salt in water to the to his skin. So as a result, he's become dehydrated. So the sodium in the body of a marathon runner can go up to 180, 190. So when you give them water, they drink a lot of water. They correct their high sodium very fast. And if you do rapid correction of your sodium, what happened? This rapid correction meets with the normal correction of the body, and then what happened? You have water going into the brain, and the person can go into coma. So you're not supposed to give a marathon runner water while running, because you're killing that person. Okay, so this is to show you even water has side effect if you're not doing it right. Okay, any question? Yoli Kade, salut, Shadow Live. Any question on that first topic? Any question? Any question? Any question on that first topic, which is a whole revolution in medicine? Hi, Yolikade. How are you? D, you have a question? Go ahead. Carl Canoïdois. Salut. D, go ahead. Est-ce que vous avez une question là sur ça que je parlais à soi là? Parce que c'est une nouvelle révolution de médecine. Bah, tout neuf qui fait tomber. So, tout bah qui neuf yo, bah nous yo. Et pour nous éduquer tête nous. Pour nous et le bon macho. Garçon pas, m'on non pas capable là, m'on non pas capable là, m'on pas capable voilà. Il y en a me dire que does that mean that you shouldn't drink water while working out? You're not supposed to drink a lot of water when you're working out. That's not good because you can go into coma. Yeah. If you are working out and you're sweating a lot and your body become dehydrated, if you drink a lot of water, you can go into coma. Yeah. The best thing to do is that a Gatorade. Yeah. Yeah. Because it's like Gatorade is like electrolytes. They gain sodium, potassium, everything in it. So that's the best thing. All right. Can you give a couple of names of this new medication? One is called Jardiance. The other one is called Farxiga. Okay, Jardiance and Farxiga. Farxiga. And the other one is Jardiance. Jardiance. Diance. All right. Let's voir. Edwidge Bomacho. Whatever. Okay. I have a friend who has a diabetic. Her doctor recommends bariatric surgery. Now she's on a high protein diet. That's a bad thing, there. Very bad thing. Very bad thing. A high protein diet will kill her kidneys. A high protein diet will kill her kidneys. So first of all, before the doctor put it on a high protein diet, the doctor should ascertain whether that patient doesn't have evidence of diabetic kidney disease. Right? So that's the first thing the doctor should do. The doctor should ascertain whether or not that patient has evidence of diabetic kidney. If that patient has evidence of diabetic kidney disease, a high protein will kill her kidneys. So, I would advise your friend to get a second opinion. Where Edwidge won't you with that live brother, won't you with that. Dire que protein shake every day, is that okay? Protein shake every day is not it's you have evidence of if you're diabetic, I would advise you to stay away from high protein shake. If you're healthy, it's okay. But if you're diabetic, I would advise you strongly to stay away from protein shake. Rose Magali, Etienne, bonsoir. Bonjour, je vais répondre à une question. Bon, 2-3 médicaments. Mais je suis d'accord, moi gagner un anti-diabétique, il est toujours fatigué. Il est toujours fatigué, c'est parce que, il a gagné problème que, deuxièmement, ce qui est capable de contrôler. Ouais, fatigue alone is a sign of heart failure. Ok, Michou? Fatigue seulement, c'est un signe de maladie qu'est. So, si que matin tout fatigué, so, faut you garder quel bien, il a gagné problème qu'est. So, docteur la pour faut docteur faire plus test pour lui, pour garder pour qu'il soit fatigué. Premièrement. Deuxièmement, faut docteur garder s'il pas anémie. Troisièmement, faut docteur garder si sucre bien contrôlé. OK? Quatrièmement, si anti ou là, li gros en pile, li gros en pile, li ka gagné phénomène de sleep apnea qui fait que vous fatigué. So, c'est toute une série de domaines de investigation pour ma tante et d'autres affaires pour lui. So, bon aussi plus description de ma tante. Dis-moi combien poids ma tante est. Est-ce que ma tante gros en pile? Expliquer fatigue là. Est-ce que son fatigue qui vient avec des pas à respirer bien? Est-ce que tout le bagage fait, il ouais faut camper? Est-ce que li ouais que li gagne, est-ce que fatigue là tout aussi bientôt? Non seulement li ka heart failure, li ka un problème, on artère qui bouché. OK? Mais on artère qui bouché. So, ouais tout ba ça. Faut que docteur prenne un pile attention avec on sera diabète. Avec parce diabétique yo compliqué. Mon cas de fatigué et puis mon nan son artère qui bouché. So là comme ça, fatigue l'on supposé faire docteur pousser la faire test pour lui. OK? All right. Tanya que ibuprofen is for blood pressure and diabetics. Yes. There was a study done on this is called Avapro. There was a great medication. There was a study done on ibuprofen for blood pressure and diabetics. Now, Kenny, so that's what I'm telling you. The ibuprofen are angiotensin receptor blockers. What they do, they retard the progression of diabetic kidney disease, but they don't stop the disease completely. So those medication, ibuprofen, they used to be the darling of blood pressure medication in the 90s. Yes, they're great, and this, as a matter of fact, it is still recommended for those for diabetics to be on those medication. Yes, still. However, the new class of medication, not only they provide control of the blood sugar, they stop the disease process at the level of the kidneys. They ameliorate the heart, prevent a patient with diabetes to be in heart failure. They prevent somebody to go on dialysis. They prevent the serum creatinine to double up. They prevent somebody to go for transplant. That's the difference of those. That's the difference of those medication. Yes, for example, captopril in the 80s did show also it prevents the doubling of serum creatinine. That's true, but those medication, the new class of medication, they're different because not only they act on the kidney, but also on the heart. Ibuprofen, captopril, losartan, ramipril, let's see, those medication, they retard the progression, they slow it down. But the new class of medication, they stop it. Okay, Kenny, good question. She had the surgery and now she's off all meds. But a high protein diet every meal, and she was a severe diabetic before. I'm concerned about the kidney. That's exactly right. So this patient should see a nephrologist to assess her kidneys, and the high protein diet can be detrimental to her kidney, Victoria Hill. That high protein diet can destroy your kidneys very easily. So I would urge you to make sure that your friend to seek a consultation with a nephrologist. Deborah and Glenn, my sister, how are you? Okay. Edwidge, ou ka boire de l'eau après fin workout, mais de pou pas boire trop de l'eau. On prend, ou pas ka fin workout, ou boire 2 gallons de l'eau. Ok, mais au cas boire une bouteille de l'eau. Ça va faire rien. Mais c'est monde qui finit workout en pile, qui souhaite en pile. You perdu a lot of water to the pores of the skin, and then y'all drink a lot of water that can go in, they can become confused, and then they can go into coma. So, et ça fait que, moi dis nous que, lè que on moun ap kouri, un marathon runner, ou pas courir bal de l'eau. L'eau bal de l'eau, c'est comme si là, on mettait un poison dans bouche li. Parce que, a marathon runner should not drink a lot of water. En pile nan yo succumb. En pile nan yo indisposé. Et en pile marathon runner qui mourit tout. Ok? Yes. Pile marathon runner qui mourit. Et ça fait que, là où marathon ap run, ou toujours gagné dans pays sérieux, oui. Dans pays sérieux, ou docteur ou ambulance, ou que, et tout un système appareil médical en place parce que il y a un pile nan yo qui sont victimes à partir de par exemple tout il y a marathon runner qui a couru et puis you break down their muscles. This is called rhabdomyolysis. Rhabdomyolysis can cause acute kidney injury. Somebody after a marathon can go on dialysis. You know that? Somebody who's a marathon runner can have breakdown of his muscles, and that the end products of this muscle can go into kidney, blocking the kidney, and cause acute kidney injury, and that person may require dialysis. So it's not a simple thing. Okay, guys. Il fait 7h10. Nous avons commencé à 6h pile. Nous parlons une heure de temps sur une nouvelle modalité de traitement ça avant que même continuer. Et deuxième topic là, dans la qu'on est, est-ce que nous parlons une question là? Ok? Parce que même si nous pas poser question peut-être pas nous pouvons poser question pour maman nous, pour papa nous, pour amis nous, pour soeur nous, parce que bah ça c'est exactement Marjorie. Stop the disease. Yeah, and Marjorie, this is new stuff. This is new stuff. New stuff. Bah qui fait tomber là, bah qui fait sortir de yo là, et que même et bah tout docteur qui aware of that yet, unless that you are in the field, you know those things. Okay, so definitely it's a big revolution in all the way. It's a big revolution in the treatment of the disease. Okay, but they are recommendation when to start this medication. Okay, guys. Any more question? Any more question about this topic we just discussed? Okay. The second topic we're going to talk about is the social issues. Why people who are divorcing, especially men, when they divorce the ex and they divorce also their children. Now, you can love somebody to a point that you think that you will end up having your life with that person, and along the way, it is macho. Thank you, brother. Thank you, bro. Was Magali Atiam? Thank you. So you can think that you have somebody in your life, and then you think that a person is going to be your soulmate, and yet along the way you find out that the person is not. Now, it is more complicated when such a relationship has children, because divorce usually brings pain and ache, and the pain and ache is mostly to the children than to the person in question. So many people stay in a relationship many times because for the sake of the children, because divorce kills the psychic of children. Having two parents living in different homes, and especially if you have a boy, raising a boy without the father, usually is a tough task. So many people will think about twice before they engage in such rots, because this et le bon, il dit que gen femme qui vle ouais petit tout, mais gen femme qui fait tout ça capable pour pas ouais petit tout parce qu'il regrette ou bien li raille. Very good, Edwidge. Nous parler de ça tout à l'heure là. So the divorce usually bring a lot of pain and aches to the children, and for somehow many women use their children as a shield to hurt men, and immediately a woman goes into divorce with a man, they think that the children is probably the best way to get back to the man. As Edwidge said, no, Raul, my friend used to take metformin, now the doctor changed to glimepiride. Glimepiride is a good medication, but it's like it's a softener-like medication. It melts your sugar. It tends to bring your sugar down. It makes you more hypoglycemic. So I would advise your friend to stay on the metformin. So many women use their children as a shield to fight the man, especially when they know that the man love the children. So this create an animosity in the man toward the woman. Now, but many women go beyond that. If a man takes care his or her his children, he is a good provider for his children, why the hell you want to go to child support for that? You want to go child support for the man? Huh? Tell me. If a man is divorcing you, and the man he knows his responsibility toward his children, take care of his children, why the hell you go to get child support for your children? And any woman who's smart enough, who has a minimum brain, you never try to get child support for a child knowingly that his father cares about him. Deborah, that metformin causes ED and a black box warning for patient over 80. Well, I don't think metformin causes ED. No. It's as a matter of fact, metformin should improve ED by controlling the sugar. The reason somebody has ED is because the sugar is badly controlled. Okay. Now there are a lot of patients taking care of taking care of patient who are 80 taking care of metformin. Now, however, let me tell you, the reason why they put a black box for patient who are 80, because as you get older, your kidney function is diminished. So there's a controversy about the use of metformin in patients with a kidney function less than 30 ml per minute. Okay? There is a controversy. Okay, Deborah? There's a controversy in using metformin in somebody with a kidney function less than 30 ml per minute. So many people who are 80 years old, they have a low kidney function. So they have to be careful when being treated with metformin. Okay? So a lot of patients who are 80 are taking metformin. Okay. All right, Deborah. But very good question. Yes, exactly. Metformin is good for ED because it improves insulin resistance, it controls your sugar, and it decreases the glucose toxicity at the level of your penis, and therefore you have a better flow in your penis, and hence your erection improves. So metformin is good for ED. Now, let's see. As I was saying that, D, I'm gonna answer you. I'm gonna read your comment very soon. So, if you're divorcing a man, and you know the man is responsible for his children, and there's no reason to go and get that person for child support. And this, whenever you call a man who's responsible for the kid, for his kids, you call him for child support, you're gonna create such animosity in that man. However, there are many men out there who are irresponsible. They deserve that. But a man who is responsible, a man who cares about his children, women should not do that and try to get money out of them. For as a matter of fact, sometimes the children get more from their dad or from a child support, because child support, all you do, you give one money, you're done. A father who cares about children will come and pick up his children, go to game with the children, shopping with their kids, pay for their school, and the kids will get more out of it, and then the kids will get a better relationship with the father. So I think the reason why many men get divorced with their children and with the ex at the same time is because many women are greedy. They're greedy, and they think that they want to revenge. They want to revenge. They want to revenge by putting the man into dire situation for the man to be cornered. So when you do that, you're punishing yourself. You're punishing your kids. Okay. If you have a man who cares about his children, there's absolutely no reason to go out there to get money from the government to take care of your kids. So that's why many men feel so bad, and they go out of the way, and then they despise the children, they despise the woman, and they stay out. So women out there, I hope you're a little bit more thoughtful, more smarter than that. A lot of you want to do quick bucks. You want to punish your man, your ex-man. You're not punishing your ex-man. You're punishing your kids. All right. You child support given to a man who cares about his kids will create distance with the kids. All right? So you're not doing a favor. Okay? Let's see. These things are, it's more common to see men move on with their life and forget they had children that they're still responsible for. Once they're divorced, they need their money to put into their new relationship. So providing money consistently to the ex for the kids is not their main priority. But this is a man who is irresponsible. Any man, you can divorce with a woman, but you can never divorce with your kids. You can divorce with a woman. You can forget about if your woman exists, but you can never divorce with your kids. Your kids are your kids. But many women, en pile femme, fait garçon, vin rayi, ni yo même des petites yo. Parce que son garçon, li care pour petite li. Même si vous divorcez avec elle, pas besoin à des cob pour extra pour te quitter moun nan. Parce qu'on connaît comme tu as là pour ti moun nan. Et l'on fait ça, ou créer une animosité là quand monsieur, ni pour ou, ni pour ti moun nan, et puis c'est ti moun nan qui paye ça. Donc mesdames, faut nous un petit plus smart. Si nous avons un garçon qui est irresponsable, qui lague nous avec des trois ti moun, oui, on est d'accord pour nous faire ça. Mais si nèg la prend responsabilité li, il te ket ti moun ni, ça c'est bagay stupide, bagay idiot n'a fait parce que nous crier, nous fait nèg la vini pi enragé, nèg la pas vle ouais ni madame ni ti moun. Okay. Deborah, England, you're welcome. What's that good? Child support is not something that I believe in, but some men does deserve it. Just saying it. I agree. Pamela Apple, how are you? Moi, je dis pas que, Doc, sometimes they go for child support. The judge give them less than what the father was given originally. The emotion and vindictive attitude is a factor of them losing everything. That's exactly greed. A lot of women, they go out of vengeance. They're about greed. And child support is not the best way to raise a child. Because, you know, when you give child support, the system takes money out of because they are bureaucratic expenses. They take out of the child support, and then what you're getting is not what it's meant to be. So the reason why that child support is keen for you to pay is not because they care about your child. No, they don't care. They know they're gonna make money out of your payment. Okay, they know that you want to make money out of the payment. They make sure that you pay. They don't give a damn about the kids. So, if your ex is irresponsible man, is working, is functional, and he doesn't take care for his kids, yes, you have a legitimate right to go for child support. But if your man is responsible, he takes care of your kids, he makes sure the kids is well taken care of, he pays for his school, he pays for his or clothing, he's paid for everything possible, and he spent time with the child. Why the hell that you want to call this man for child support? What's wrong with you ladies? What's the matter with you guys? Huh? Where's your brain at? You make the man angry. You make the man mad because no man wants to be in that situation because you minimize his importance as a father. Okay, exactly. I love females, but I won't date a female who is not functionally stable. I've been there, done that, and I won't make that mistake no more. Brother, I don't blame you, bro. I don't blame you, brother. I don't blame you, bro. I don't blame you. I agree. You need a woman who is more or less has a job. The woman is functional. The woman can sustain herself a little bit. But you don't need a woman who rely on you for everything. If the woman relies on you, it's because you want to do it. But the woman can afford certain things. Right? So, brother, I agree. Kani, thank you for concurring. Yeah, Marjorie a bien passé. Et en pile, mesdames, je pense que les garçons en code pour child support, yo connaissent bien à faire pour ti moun nan. Ou fait nèg la ray ti moun nan. Ou fait nèg la ray, ou nèg pas ouais ti moun nan adore. Et puis que li vinn tourner son nèg payment, nèg font car payment. Nèg font car payment. So bon les ti moun nan les child support la fin. Les child support la fini. Ça ka passer. Ou font ti moun grandi sans pas qu'on pas parle bien. Surtout ti garçon. Ti garçon, n'importe ti moun. Un ti moun qui levé sans pas parler, son ti moun qui raté, il manque un bagay. Et le plus souvent que c'est femme yo qui poussé à yo faire ça. Tellement que yo gon gens, femme gon gens, yo pense que les non divorce on nèg puis yo ka craser des nèg là, puis foncer de bagay. Et pourtant que vous en avez que c'est femme qui craser tête li. Hein? Because no matter what, life goes on. Life goes on. So, mesdames, t'as conseillé pour nous réfléchir, on a fait stupidité ça, parce que c'est pas du bien à faire pour ti moun nan, nous mettez ti moun nan dans mauvaise position, n'a fait ti moun, n'a fait nèg la raï ti moun nan, raï femme nan, pas vle femme nan. Donc ça a mérité à réfléchir. What's Doc, I don't believe in forcing someone to take care of their child. Women in this situation should raise your kids right. Don't talk bad about the father. Doc, I don't believe in forcing someone to take care of their child. Women in this situation should raise your kids right. Don't talk bad about the father. Education is the key. You give your child where the man regrets not being there. Thank you, Rosemary. So, under all circumstances, mother and father are the primary source of financial, emotional, spiritual, physical support for their children and should want the best always for their children. I agree with Magali. Sandra Goman, salut. It takes wisdom and understanding for a couple to review their personal relationship to find a common ground and see the children's welfare. But many women don't think this way, because many women, they are selfish. They think about themselves first before they think about their children. So that's why the children always suffered from a divorce. Always. Because some women don't have the least of understanding that common ground. The common ground is not for them. All right? So some women are emotional. Some women are very unsteady in terms of their thinking process, and they rush into judgment without thinking. And then the repercussions usually are the kids. Yeah. Margaret Fodiaker, they are employed women who make more money than their ex. True. Doc, I was in the 4th grade when my parents divorced. My dad never gave my mom a red cent for my brother and I. My mom is an extremely proud woman who said if he wants to provide for us, she will She will, she will, my mom said she's an extremely proud woman who said if she wants to provide for us, she will accept it, but she will never ask for a dime. That's a strong woman. Long story short, my mom put us through college on her own. My father gave me $250 when I was graduating from college at 19 years old. That was his only contribution into my life. My mother should have put him on child support because kids need to eat, have shelter and clothing. Why should the mom be the only one to sacrifice for the kids? Yes, that I agree, because your father probably was very irresponsible, but that he deserved it. But for somebody who is responsible, a man who really has a sense of responsible towards his kids, child support is not the best way to go. Child support is a deterrent. It makes a man mad. It makes a man angry. You create hatred. You create animosity in the heart of a man. So this is the worst thing a woman can do to a man. You destroy whatever the man had for you. I don't think it's a good way to go. I raised my son alone. He's well-mannered and well-educated. Actually, in medical school now, never ever think once of going for child support. Very good, was Mauricio. I'm proud of you. I'm proud of you, sister. I'm proud of you. Nearly desperate. Salut, shut alive. So I believe if the father doesn't want to take care of the children, you need to file child support. Well, you have to be careful when you do that, Sandra. Yeah, if the father is making money, the father is has a job, and you have 3-4 kids you're raising by yourself, yes, that's something that you should think about, maybe. But there are some women who are so proud of themselves. There are some women who cares so much about themselves, who feel so, they respect so much themselves. They will never do such an act. Never. Sometimes the grandmother, the aunt, and other family members do not care for the child if you put their son to child support. I agree. I agree, Keta. You're right. You're right. What's my guy dire? Gen femme ak nek ki mécanique en pile. Gen femme ak nek ki mécanique en pile is so sad and destructive. True. It's a beautiful topic, Doc. Many mothers should listen to that. I hope so. I hope many women listen to this message that I'm telling you, because this is the worst thing you can do to a man. It's like putting voodoo to a man. Yes. Yeah, doing voodoo to a man. You make the man fly out of the door. And some women are so stupid they don't even think about that. They think that for an act of vengeance, they will go and ask for child support for the child. And all you do, you create animosity, hatred for you and the kids, and that man will disappear in that children's life and your life forever. You never see that man anymore. Yeah. Yeah. Well, Rosemary, so that should be a hard, that should be a heartless person who can do that. Yeah, I don't think a heartless person to do that. I don't think that un men qui fait ça, connaît que son nez qui vraiment, qui va un cœur. Mais, je crois que, au moins qui a un cœur, a fait action ça. Danny, hey, I know, hello. How are you doing, Danny? You've been missing a lot. So, Danny, n'a parlé à ce là, nous parler sur question de sucre, et puis nous parler, disons ça que, et ça fait que, en pile garçon, les au divorcé ni à femme, ni à timoun. So, nous disons ça que, tu vois, il y a plus de raisons qui fait ça, nous bail, et nous bail plus de raisons pour ça. Donc, mon opinion là, on dit que sweetheart child support is not for the mother, it is for the kids. Only Asian men take this bad. I have friends who pay for child support and they continue to take care of the kids. Very few do that, Danny. Yeah, because most of the time, women impose child support to the man is just to bring the men down, to make them revenge, to some kind of vengeance. Yes, and some men never forget. Some men never forget, and usually a woman will get more out of a man than from child support, because the man will not only provide financial means, but the man will provide love to the kids. What is more important, love or money? Eh? What is more important, love or money? And some women don't think about that. They think about money. And money is not everything. Money is not everything. The most important thing with the relationship between a father and his kids is not monetary relationship. The relationship between a father and his kids is not monetary. The relationship between a child and a child is love. Is love. All right? Is love. So money is not a factor that should come into play between a father and his kids. Okay, can I just one day make this topic first? I know you prefer to talk about med first, but this is very interesting. Thank you, Kelta. No problem, my collaboratrice. I'll do that because whenever you say something, I always listen. Amelia Dianke, choose your words wisely. What do you mean voodoo? Are talking about my culture. Now I don't know what you meant by that. Because I did mention about something about voodoo, you probably take it out of context. You go way Emilia, you take it way out of context. That was not to demonize voodoo, not at all. As a matter of fact, if there's one person in the community as a intellectual who's praising voodoo, who's trying to create some kind of awareness in the community about voodoo, is me. I've done a couple of shows about voodoo, so you probably take it out of context, or probably did not understand what I meant. That is exactly, I disagree, Dr. Benoit. You can disagree. It's okay. It's okay to disagree. I understand that. But nevertheless, child support is never the way to go. If a man is responsible, yeah, it's the worst thing you can do to a man. If the man is responsible, if the man cares for his children, do not do that. It's the worst thing you can do. There's a lot of female who use the child support money to buy expensive purse Yes, some Gucci bags, some Celine bag, some Valentino bags, taking care of the boyfriends and eat out. That's true. That's true. Asian men don't take care of their kids. That's not true. That's not true. That's not true. That's not true. Just like there are a lot of other men who don't take care of their kids. All right. I think that's the way you are raised has an impact on how you take care of your kids. Okay. There are many men that I know in my circle who are great fathers. Great fathers. They divorced with their wives, but they are great fathers. Yeah. But that is not only the woman that display bad behavior. Sometimes the role is reversed. That's true. That's true. That's true. That's true. I agree, Marjorie. The men who are responsible are very far and few in between. Most men don't take care of their kids. By the time the woman files for child support, it's because they have tried everything to provide. So, in that respect, I agree. But in that respect, I agree. If a woman try all the avenues and try to get the man into a common bring some common sense to the man, and for that person to take care of the kids, and then he refuses to do that, I think that you leave the woman no more avenue to call child support. But remember that child support always create animosity between child, and unless the man is a very his love is for his children is enormous, so he doesn't want to leave that child support business deter the relationship with his kids, and having a child support, he still can continue loving the child. But usually child support is a bad thing for children. Very bad thing. Very bad thing. Maggie Dagger, I think child support is degrading. The father should be given a choice, not forced to contribute. I think, Maggie, you have a point there. Nelly Dianke, what about not doing either one? Not doing either one. What do you mean, Nelly? Can you be a little bit more specific? Doctor, did not. Okay, I hope so. I didn't say anything bad. Okay, brother, thank you. Oh, I didn't say anything bad. One woman I know took the father's child support for a large amount. They only give her $25 per month. Foku kon la poila. Exactement. Yes. Yes. Yeah. But I think que c'est question ouais gen tout ça dépend que job gen qui ça au fait les qu'on est parlé de child support en pile là pas travail en pile là situation de travail en pile là yo pas de real income, and so on. So it's usually a major problem sometimes, but nevertheless, child support is usually pas the way to go. Mimi Love, salut. Alright. In my brothers, in my case, our dad is now old, and he has a few stroke, and his family thinks is our responsibility and want us to take care of him. We are giving him the same amount of care he gave us. I sent him $500. That is the $250 and give me plus interest. That's the extent of his investment in. Oh wow, that's a good one. That's a good one. Wow. Yeah, that's a good one. That's a good one. Yeah. And Eh bien, c'est là, le problème là, est. Les nèg yo, pas te petit yo, et puis yo vin grand monde, c'est the worst thing ou ka gagner, les que, ou grand monde, et puis pour petit demande que, Dad, what have you done for me? That's the worst thing can happen to a man. That's the worst thing can happen to a man. You're older. That's the time that you will need your children to be by you. And then they're trying to ask you a question. Dad, what have you done for me? That's a killer. That's a killer. That's why men, I say, non, tout garçon, t'es qu'est petit, non. Parce que c'est plus gros satisfaction qu'a gagné. Mais même, I can feel the satisfaction with my kids. L'organ petit tout, à l'âge où il est là, il a fait maintenant, il a pris le daddy, I love you, daddy, you really my travail, daddy, I love you, my son will call me, wherever he's at, tell me, dad, this is what I'm gonna do, can I do it? Gamoun. They always look for my approbation for everything. Depuis toute là ensemble, make sure que nous tous allons manger ensemble, having some time. So, yo aimé aller en vacances avec moi, ou comptez que leur grand monde, petit tout pas aller en vacances avec vous, et bien, petit pas mieux, yo aimé aller en vacances avec vous. Yo aimé ça. They enjoy to be with me. So, I think it's a good feeling, man, knowing that you're getting older and your kids are close to you. Your kids look up into you, and that's something that I work hard in life to make sure that it happens. You know, so I think it's not the best. It's the best feeling that could be to my doctor what you that would do for me. So like my kids, when they look at me, they say, "Dad, thank you for your sacrifices. Thank you for everything you've done for us. Thank you. You give us the best." That made me feel good. Yeah, this is my legacy. This is what I work for. Not the homes, not the cars, not for anything. It's the joy that I've accomplished my job as a father. Make sure that my kids are okay. They're raised well. They are academically and professionally accomplished. That's my job. That's what I feel that's the most important thing for me. That's the most important thing for me in life. That parce que regardez, mon gros garçon là, Joma, ouais Joma, même quand c'est Joma, pour Joma t'a dit dad, ou pas faire moi. Comprendre? Je regarde mon yeux, mon cher, m'tap mourir mon cher, m'tap ça me feel bad. Si Joma t'a campé dire que dad, you didn't do anything for me. But Joma toujours dit ça, Joma call my dad, thank you for everything. Is it dad, whenever I'm travel, I see when my kids are going through with the school loan, I didn't have to go through that, all right? Because you pay my school in cash. Because I put my school loan on the side to pay for the school loan. You see that? Because I did not want them to go through what I've gone through, right? Right? So I make sure that they're debt free, and I still have debts on my own, right? So I put everything. My debts on side, make sure that they're accomplished, and they are grateful for that. So pour monsieur là, même si que essayez toujours que mes petites nous close avec nous parce que bonjour pour nous grand monde. Et nous pas les petits monde à dérespecter nous grand monde. Et puis mauvais bagaille pour petit à dérespecter pour dire qu'on pas faire rien pour son inutile pas rien moins. Is the worst thing. Kenneth Gook, salut, share the live. It is like not all Asian men are the same. Sorry for your bad experience. Exactly. Et donc, je suis d'accord. Mais il y a un pile bon garçon haïtien de yo. Un pile femme tout fait garçon haïtien vini vini bitter tout. En pile femme haïtienne fait garçon haïtien vini bitter. En pile femme haïtienne you fait garçon vini bitter. So that's something you got to think about. And then in Florida, if you're divorcing your significant other, they will automatically put you on child support. Wow. Yeah, oh, I didn't know that. Magali Simon Montilus, salut chez the live. Véronique Jean-Louis, salut chez the live. Fresnel Combit, salut chez the live. Mina Jean-Jacques, salut chez the live. Okay. So, Doc, you are one of these exceptional men. Kudos to you. I don't think so, Marjorie. I think they are the men like me. But I'm very close to my kid because I adore my kids. I love my kids. They are my pride. And love gade Joma, it's me, man. Je n'ai pas fait jalousie. Je n'ai pas gade là. Mais love gade Joma is my photocopy, you know. It's my copy. And monsieur fait même avec monsieur qui est pour maman même genre monsieur qui est pour maman même j'aime tant qui est pour maman. C'est monsieur qui est même avec monsieur qui est pour maman même genre maman. Si monsieur de yo la pour les mamans 10 000 fois dit maman ça maman manger. Monsieur va la pas bien maman just like I used to do. Monsieur a wash maman ni just like I used to do. Monsieur gagné toutes caractéristiques que m'te qu'on fait pour maman. So, l'on regarde un petit garçon comme ça, l'on regarde monsieur, regardez c'est mon même. Monsieur dormi même genre avec, monsieur gagne même physique avec, là, monsieur gagne même quoi, the same body as me. Vous comprenez? Monsieur, except he's more jovial than me. Monsieur more jovial than me. Mon petit genre parfois très sérieux. Monsieur more outgoing than me. Mais même pas that I'm outgoing. Petit film dans le même caractère avec. Mais l'on regarde petit tout, l'on regarde your mirror image. Et vous pensez un jour, you're not gonna be around. You see, I'm living, even though I'm not around, and I know that there's somebody who looks like me who's gonna be there for people to be reminded of me. It's a good feeling, man. So that's why I'm fond of my kids. But I invested times in those kids. I invested a lot of time. La team était petit, man. M'était fait commencer une question de médecine. But every weekend, we used to do some every weekend. Nous toujours gon, on bagarre à faire every weekend. The weekend by daddy, what are we gonna do? Every weekend, ou du moins, Six Flags avec, ou du moins, I'm in the Poconos. It's either, bon, going pork, les timons ont été dans team jo. M'te qu'on voyager 4 fois pour sommer avec yo. 4 fois pour sommer avec yo. Gon sommer, nous sorti dans Spain, après ça dans la Uba, après ça dans les tel côté, nous fait I mean, so kounya la, même si kounya la, you connaissez grand monde, they have their own lives, but they never forget those good moments. So for investing dans Timono bonheur tomorrow, for that feeling to stay alive. So pas d'investir the time, Timono a grandi, les Timono a commencé grand, et puis la sorti détaché de haut. Right? So you have to invest the time early, very early, for that relationship, for that bond to remain intact. Mais si que ou al développer un bond, les petits moun nan gen 20 ans, 21 ans, it's too late. Mais même te créer bond ça, les petits moun petit, m'pas quitter my profession overtake my responsibility toward my kids. Hein? M'pas quitter profession moi, m'pas prendre profession te vini secondary. My kids came first. Pour d'abord, c'est mais dans l'école, me lever grand bonheur 5h du matin, mais tout à l'école. Petit garçon dans l'école marathon, me piquer marathon. right? Tu finis t'es l'école, non, l'école catholique in Bay Ridge, right? Mais l'école, m'passe prend yo l'école, m'dépose yo la caillou, yo te gen bonne, m'fait manger pour yo, confine mal l'office là. Hein? Parce que yo te même m'fait manger pour yo. Hein? Quoi que maman yo ka fait manger pour yo, c'est daddy qui fait manger pour yo. Right? So, you know, I invested time in those kids. And that's why today I'm m'a récolté ça me faire. Comprendre? So, m'pa essayer créer pour me faire nous comprendre que I'm the best guys. No, that's what I'm trying to tell you guys. Alright? M'a dit non que faut investir dans petit tout pour que bon nous gagne ou atimoun nan li rete intact. Alright? Ouais, si m'gon problème là, Jenica, et la prendre gel, c'est mon problème. Yep. Sometimes I wonder myself, le jour mourir, qui est un petit monde parce que tellement tu me attached to me. Yeah. Si mon problème là, si mon bail kakasim là, Jenica will come to me, carry some daddy, what's the matter, daddy? Right, what can I do, daddy? What can I do? But let que building là t'étais boulé. Those two kids, they were devastated. They were devastated. They feel that they should daddy, what can I do, daddy? Tell me what to do for you, dad. So, you know, and pas regret sacrifice ni kon fè yo. Comprendre? Et m'gen pilote garçon haïtien qui comme ça tout d'ailleurs. M'pa même sel. Un pilote garçon haïtien comme ça. Comprendre? Comprendre? So, mais faut nous que même femme haïtienne pas ba femme yo dégoût. Pas ba garçon dégoût. Tina lui salut, Marjorie Apollon salut. Et bon ouais. Oh, OK. Bien que my husband's father is an amazing human being. I see how he is with his kids until this day, and I wish I had experienced a father like him. His kids are in their 40s and still behaves with them as though they were 2 years old. That's nice. He taught them everything they know. All his 6 boys and 2 girls are amazing human beings. Because of my father-in-law, I know what a father is supposed to be like. My husband is just like his dad. My kids are blessed to have such an amazing dad. As for me, I'm still hurt and angry at the sperm donor that's supposed to be my dad. I know. Where you're lucky to find a good man, because many women who were not raised by a father, they end up having very bad relationship. So kudos to your husband. My mom is a rock star. She was mom and dad for us. There is nothing I would not do for that woman. I added an in-law suite to my house so I can take care of her. Now her passion is traveling the world. So I do appreciate for you to unveil this personal dilemma that you have traversed in your life, because not too many people has the guts to expunge the bad feelings they have to the world, because it's something that probably that really hurts you, and you find this forum to express it. And I thank you very much. I thank you for your candor. I thank you for your honesty. I thank you for your self-revealing. And I think that your contribution can help many men reading your statement. It's something that you don't want any child to feel this way. You see, bitter that's the way that when a man does not take care of his children, that's the way that you're gonna feel. You're gonna feel that you're less than a human being. Your kids gonna make you feel less than a human being. Okay, good evening, Marjorie. This topic is wild, but you won't be able to do it the same exact way. Good lesson. I agree. That's true. Maybe right. I might not be able to do it the same way. Ludmila lui, Zami Pam, qui joignent. Good evening, good evening. Excusez-moi un petit moment, hein. Bon, un petit moment, tout seconde là. Je vais prendre un chargeur là parce que je presque pas un charge. Give me 1 second, 1 second. Ok, merci bien pour votre patience. Don't go anywhere, guys. Don't go anywhere. I'm here. I'm back. Presque pas de charge. Ça fait que je vais chercher ma charger. Ok, kounya la, magen. Ok, so, tout le monde a voulu que me continue. Il y a que semble donc wap courir parce que moi t'entendais bripio. Yeah, m'a cherché chargeur dans l'autre chambre. Moi je dis que Doc, the continuation of the second topic of the second topic on Tuesday. Okay. Qui a demandé lui? Qui a demandé lui et Marjorie demandé lui? Qui l'autre monde qui demandé encore? Et son topic vraiment qui est important est que pour un pile garçon comprendre ça, néanmoins, il faut nous dire comme ça que et chaque support pas supposé faut un excuse pour te petit tout. Parce qu'au cas divorcer en femme, au cas pareil femme non du tout bon envie encore, mais pas qu'à divorcer à petit tout. OK? Petit tout c'est son lié. Vous comprenez? Au cas divorcer avec une femme n'a pas vraiment envie encore, voir existe femme non. Mais petit tout is something that you cannot divorce with your child. So, en pile femme à plein, disant que garçon n'est pas responsable, garçon n'est pas, et en pile garçon haïtien, pas face the responsibility. Mais, il y a tout, disons ça, que en pile garçon haïtien, comme ça, vraiment. Depuis par la femme, non, et puis, il n'y a pas petit là, tout. But, en pile fois tout, c'est à cause de femme, yo, tout, qui fait garçon comme ça, tout. OK? Moi, je dis que, sorry, what about of the continuation of? OK. OK, on dit que, moi, je dis que, on dit, the continuation of the second topic on Tuesday. OK, d'accord. Moi, je dis que, sorry, what about the continuation of what? Il dit que moi demandé l'île tout. Good topic. Okay, very good. So, en plus, mon a demandé là. So, mardi, on a continué le topic là. nous pourrons regarder peut-être un autre aspect de lui. Nous allons regarder que the pros and cons. The pros of child support and the cons of child support. Nous allons regarder ça. Et dire que c'est pas faute nèg là, parfois parce que gen fille leur pas avec ou encore yo raillé pour la vie. Oui, ça c'est vrai. Hein? Ça c'est vrai. Oh, c'est vrai, Keta. You remember, you'll be out for a few weeks. Okay, I know. Keta, après ça m'a pris là, vous dire que Tuesday, you're gonna be here, right? Tuesday? I hope so. Keta, I hope Tuesday you're still gonna be here. I think you're traveling in March, right? Yeah, you're traveling in March. Yeah, you told me that you're going to travel in March. Right. I think you're still going to be here on Tuesday. Anyway, oui, et lui, il y a un pile femme qui fait ça. Il y a un pile femme qui monte tête Timonio. Yes. Tout le monde n'a pas l'air Tuesday. Il y a un pile femme qui monte tête Timonio. Il fait Timonio raille papa. Ok, attends. Il fait Timonio raille papa. Et puis il vient crier, Timonio vient une animosité. March 4th. Okay, very good. Il fait Timonio une animosité toward his dad. Ok? En plus, l'information pas bon, hein? En plus, l'information pas bon. Parce que parfois, les gars, qu'on gagne good intention, et puis, ça que femme fait, li monte tête Timon contre papa. Il dit papa pas bon. Il dit papa son vagabond, par son vieux bagaille, et puis Timon vient crier bah ça. Et il dit que moi fait expérience ça, oui, donc. Brother, I comprendre. It's very sad. I know, brother. I know. It's a bad experience, and it's not something that any man would like to be in, because là que ou gon femme et puis femme non quitter femme là et puis femme non monter tête Timonio contre même. Et que fait Timonio rayo, hein, parce que Timonio lui-même et Timonio lui-même ça qui passe lui-même là que maman Benoit li et le petit la quoi ça maman dit et puis la créé une distance avec papa. Et là Timon a commencé à grandir, Timon a réalisé que tout ça maman qu'on dit yo c'était blonné. Là ça parfois it's too late, parfois sometimes ou gain it's too late. Et c'est pas même love là encore parce que love c'est pas que ou create over time. C'est love pas venu pendant love pas venu durant un jour deux jours. Love somebody it's accumulative. So you have to harvest it until that you can collect it. Yeah, you got to harvest it until you can collect it. So love is loving your child. Your child is something that you build on. Et puis de jour en jour on va pas attachement à Timon, mais là que Timon grandit avec une sorte de animosité toward papa, définitivement que Timon ça lui-même et Timon ça lui vient perdu. Pas un Timon, surtout petit garçon qui grandit et puis ouais petit garçon grandit, un petit garçon grandit sans papa, son petit garçon perdu. Yep. Un petit garçon grandit, c'est perdu. Un petit fille grandit sans papa, il pas connaît ça que l'amour d'un père. Hein? Ouais, c'est the first love of a daughter is the first love that a daughter should have. That's the love of the love of a father. Listen to that. The first love a girl should have is not a love from a husband. It's a love from a father. Because the love of a father is real, is unconditional. Right? So if a girl doesn't know the love of her father, she will never know what it feels like. The love of a boy will be a man tomorrow when he's raised by a man. The man will put him in his place. The man will build up his character, and then he'll become a man. Can you see? He said, my old man. For example, Jamal always, I know, it's good to know, I'm sorry to say, c'est comme ça, Jamal connaît que my dream is to own a yacht. Right? Before I die, I need to have a boat, I need to have a yacht. And that yacht should be in Florida, hein, guys. In which, let's nigga paying serious, man, let's brother, okay? And nigga paying serious, man, let's on vient sous yacht là, nigga relax sérieusement. So you want to dad, I want to make money to buy you a yacht. Ouais, même si ça pas privé, ou parce que l'état boum c'est comme là, mais quand même, it's a good feeling, man. It's a good feeling to know that your kids really care about you. They want to be happy. Et déjà que gen ex qui toujours zanmi même si ou pas ta gen, même si ou pas ta gen femme ou pas gen femme non, la plague on l'autre femme sur le pied. Yeah. Même si pas une femme, la blague aux femmes sous dopio. Yeah. Yeah, brother, n'y million là. Et n'a travaillé sur ça, hein. Je commence à fatiguer avec réduit, hein. Yeah, brother. As a matter of fact, Edwidge, I'm fully licensed. I have my license as a physician in Florida, so I can practice in Florida now. I received my license back in January of this year, January. So I'm fully licensed in Florida. So I'm applicable licencement. So I'm working on it very slowly. So eventually, I'll be a Floridian one of these days. But I will not come and practice medicine in Florida. I will have a job 9 to 3, 9 to 4. Et puis après ça, brother, I am relaxing. I'm on my yacht. Okay. So once I leave New York, no more practice for me. I just want a job. That's it. A little job to pay my bills. That's about it. So I'm working on it, brother. So eventually, I'm going to quitter New York là parce que faut dire comment c'est de moi. Les commencer à gagner tout, on prend. So et bien besoin jouer la vie, on prend. Oui, faut dire avant. Faut dire avant du tout maintenant. Du tout. Dès que besoin faire t-shirt ben non, ben t chemise non, ben t loafers non, ben t pantalon non, relax, ouais, get coat. Comprendre? So définitivement. Bon, je crois que pas de monde qui a la question encore. On va aller là. So moi et tout le monde là share the live, hein. Share the live, non ouais que et c'est bon bagay parler là, bagay éducatif, bagay qui a bénéficié non, qui a bénéficié non, so share the live. Can I say that the father should create a bond with his children? Important to talk in the next topic. 2, the children should not be stranger to their father. Okay, I'll talk about that, and I will take it as because I will use my own experience. I can okay. That's a good thought. Ouais, qu'est-ce que besoin là, hein? Pour me direction. So n'a continué topic ça, et puis, n'a parlé, qui gens que pour ti moun, qui gens que, even you're divorcing with your children, divorcing with your ex, qui gens que can maintain a safe and a nice relationship with your children. That's why I think so highly of my mom. She never spoke ill of my father. She always told us he is a gentleman and a very soft-spoken man. Wow. He's a nice person. Her only problem with him was he was a womanizer who kept cheating on her with a various woman. He has 6 kids outside of marriage, and she was being financially responsible for the child support of his babies outside the marriage. Wow. She was tired of women calling her house and disrespecting her, so she walked away. Besides that, it was nothing with him personally. Wow. I have more respect for you than ever. I appreciate you more than ever. Because tonight you really unload yourself by sharing this, your personal life with us, meaning that we are a family. Okay, we love each other. We respect another, and you can express yourself freely without being judged, and I think that it's a great personal sermon that you give us tonight, showing us the fragility of a person's life, that an irresponsible man can affect the lives of their children years later. The scars are there, and they will never be erased. So so kudos to your mom. Your mom is a great mom. She deserves all the love, all the respect, all the accolation, all the merits, and I think you're doing it right by having her living with you. Keep her under your wing. Make sure that she's okay. Make sure that she's not placed in a nursing home or placed on assisted living. Many of us, nous tomber parfois, nous pas gagner loyalty. Et pays États-Unis fait nous perdre loyauté nous envers parents nous, en pile nous, en pile haïtien. Yo travail yo consomme them. C'est une question de faire cob, une question de faire l'argent, mais yo pas jamais ouais. Je dis à la malheureux ça, c'est les malheureux ça qui te vendre marché en bas, et c'est malheureux ça qui madame Sarah qui te monter sous camion machine et faire éducation yo, voyez dans plus gros l'école, voyez dans l'école Saint-Louis, séminaire avec petit commerce te qu'on faire. Mais je dis là, yo la qui grand monde ça dans nursing home, et puis grand monde ça vraiment yo aller net. Donc, I really commend you, and I thank you very much for the truthfulness, and then for self-revealing your emotion to us. Nicole Muller-César, salut. Donc, any more question? Any more question before I go? Any more questions? So I'm asking everybody to share the live, okay? So Tuesday we continue the same topic, but we will extend it a little bit more. Kiata, sous gain plus suggestion encore, we'll talk about it. To tell me exactly welcome. Are we gonna do that? And so we can show even better. So, any more questions? Marjorie dit, your mom is a saint. Lots of wisdom and understanding. Kudos to her. Yes, exactly. We should a lot of praise to your mom. A lot of praise to your mom. And I think that I think we should give a lot of praise to your mom. D, is it possible to have your mom live on Tuesday? Maybe because the way that your mom acted, you see, your mom did never put your husband down. Never put her husband down. Never put her husband down. He could have told you your dad is the worst guy. She did not do that. So is there any way that, I don't know, if your mom, if you're willing to do that, because that will give a lot of other young women how to deal with such a situation. You see, your mom dealt with it, and then you all of you came out good. So is there any way that you can have your mom live on Tuesday to talk to us, to give us her perspective in terms of counseling? Because those people, they are the best reference. So D, let me know. I would appreciate that if your mom can come on board, can come live and talk to us, to tell us that, okay, what she has gone through, why she did what she did, why she never oh my God. That's good. That's good. That's good. She's spending the next 2 weeks in South Africa. That's good. 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 So maybe some other time. Maybe some other time we can have your mom live and pour parler avec nous. Parce que en plus jeune femme besoin conseil ça yo. Et pour nous tendre grand monde, parce que c'est pas chez la gros livre, non? C'est pas chez la gros livre pour nous penser que nous master, non? Master, c'est monde ça. Oh, Facebook no longer allow guests on the lives anymore. Oh yeah? Oh, I never knew that. Okay, thank you, D. Thank you. Jijin dit que Doc, moi gagné un problème chaque lem fin manger, moi gagné peine sur l'estomac moi, me fait mal en pile. Okay, Jijin. Okay, now just dis-moi, m'pas besoin qu'on l'argent non? Dis-moi, est-ce qu'on a 21 non? Est-ce qu'on a 31 non? Est-ce qu'on a 41 non? Est-ce qu'on a 50 non? So that's all I need to know. Okay, I'll definitely ask her. Maybe she will tell you more than she has told me. Okay, that'll be very good. That'll be very good. Maybe she can when she's back, if we can have the show again, she can you can ask her, and then you can post her comments on the on live, and then we can learn from her. So j'ai que moi gagné un problème chaque lem me fin manger, moi gagné peine sur l'estomac, moi il fait mal en pile. So j'ai besoin que est-ce qu'on a 21 ans? Est-ce que on a 31 ans? On a 41 ans? On a 50 ans? Pas besoin qu'on l'ajoute. Mais qu'on l'ajoute. Just dis dans qui branche la jouer. OK, ma bonne opinion. Okay. You're 31 years old. Okay. So you're very young. So it's possible that you may have a couple of things. You may have reflux esophagitis, that's acid tourné back. Ou ka genyen un hernia, yeah, on head hernia. Ou ka genyen un diverticulum, diverticulum son out patch of the esophagus. ou ka genye gastritis, ou ka genye duodenitis, ou ka genye peptic ulcer disease. Okay? As a whole. So, too bad it's out. And the last one, it always put it on the back burner, is questionable cancer. Mbale fope. Okay? Kounya la, yon cancer la kati. Now, the best treatment for somebody with pain in the stomach is antacid and PPIs. The PPIs are Prilosec, Protonix, or omeprazole, et Zentak, un bel Zentak kounya la, yo retire un bel Zentak te contaminé, yon pile yo retire dans maquette là. So, c'est médicament ça ou supposé prendre. Now, et pour prendre malenta. Et puis, deuxièmement, on make sure que on pas manger dairy products, on pas manger lait, on pas dormir full stomach. Si que après 6 semaines, ouais que ou toujours comme ça, vous supposez ouais un gastroenterologist pour faire un endoscopy pour. Okay? Do you hear what I said? So, si après 6 semaines, ouais, vous faites toutes mesures ça, vous prenez un médicament, et puis vous voyez que vous style comme ça, vous style rete joint en termes que vous gagnez douleur toujours, vous supposez un gastroenterologist for them to do a endoscopy for you. Okay? All right. Okay, guys. Okay? All right. Bon, any more questions before I go? On fait 2 temps et demi avec nous là. Hein? Any more questions? Bon, eh ben, ça a été un plaisir pour moi. Maggie dit que I know someone who was feeling the same way. Okay, what else? No greasy food, and she may have acid reflux. That thing hurt a lot. That's true. Yep. Maggie, I know someone who was feeling the same way, and ouais, si que Gigine ou tenant 50 ans, nous de lundi matin, alors on gastroenterologist. Okay? Mais le fait que you're 31 years old, you should do I should thank you. I should thank you for no, Mildred, when I move to Florida, I'm not gonna have an office. No office for me. Nah. Office is over. Just gonna have a job, 9 to 5, 9 to 3. Et après, ça me sous bateau, moi, relax. On prend plaisir, moi. On prend, that's it, you know. No more practice for me. No more practice. Practice, c'est headache. On va faire quoi? Gaspiller temps, moi. No more practice for me. Woodland Jack, salut. Gigine, soutenez dans l'âge de 50 d'abdou carrément, lundi matin, à mon gastroenterologue. Le fait qu'on ait 31 ans, ou gen ba ti mesure ça pour faire mesure ça et puis si on pas get better, on prend malenta, on prend omeprazole, pilosec là cache over the counter, OK? Prend pilosec 20 mg ou du moins ou cache privacide, mais pilosec là lui-même li over the counter, ou cache li pas besoin de docteur. OK, prend pilosec et puis prend petit malenta chaque jour on a empty stomach et puis faire ça pour 6 semaines. Si vous n'avez pas d'assurance pour voir un docteur, prenez pour empty stomach et puis gardez sous, you get better. Si vous ne pas sentir better, then vous jouez un gastroenterologue. Thank you, Marjorie. Thank you for the compliment. Much love to you, my sister. Much love to you. Thank you for the appreciation. So, sur ce, je vais vous laisser. C'était avec un grand plaisir d'être avec David Noir là. Et à nous parler. Yeah. Thank you, Maggie. Thank you. Exactly. Yeah, exactly. Si tout le monde 50 ans, faut faire ça. Very good. And Kiata, thank you for the love and same love back to you. Same love back to you. Et lui a que next one bon appeal for Burn. Yes, exactly. Yeah. So, ça fait un grand plaisir d'être avec nous ce soir. But was my idea que great topics, much needed information and discussion. Bleeding Dr. Merci. You're welcome. Marjorie Dubois, good evening and good night also. So, c'était un grand plaisir d'être avec nous ce soir là et j'espère que chose ça allait entrer dans l'âme nous et puis nous qu'à partager là avec toutes les amis nous, toute famille nous pour nous qu'à pour éducation qui arrive la carrière. Donc c'est grand plaisir. So après nous mardi n'a continuer conversation ça pour nous qu'à mes conversations on t'a parlé l'autre jour là sur question de Haïti à tout, faut me tourner sur les tours, hein. Brother Pam, anytime boy, anytime brother, anytime. So Coco qu'est à dire que c'est topic ça m'parler matin m'parler aujourd'hui là c'est le même premier topic que m'a parlé peut-être que m'ca pas parler de un topic sur médecine du tout m'ca concentrer m'ba toute l'heure à topic ça que m'a parlé aujourd'hui là parce que moi ouais que it's much needed of a topic. So mardi m'ca parler de médecine m'a continuer topic ça nous pour aller élargir beaucoup plus pour nous garder que qui gens que nous qu'à apprendre entre nous-mêmes entre nous-mêmes. So, sur ce et mais merci continuez partager show fait tout le monde connaît show qui est content ouais qui est content OK so qui est mardi m'a parler de médecine m'a parler justement topic assoir là pour nous qu'à élargir beaucoup plus. So, n'a continué le choix, n'a continué le topic la mardi, et dans le temps, Marjorie content. Okay, very good. I'm sure D, you're gonna be there too, yeah? You're gonna be there, yeah? Marie, that's the only way that's the only legacy that I can leave for you guys, okay? Et merci pour l'appréciation. Hein? Donc, ma bonne rendez-vous pour mardi. Et I love you all. Take care and see you on Tuesday. Good night.